Sure. Thank you so much for the opportunity to come and talk to you. I sent a slide deck that I think all of you might have received, and we can certainly jump into some of that at any point. But I wanted to start kind of with an overview of where things stand. If you've been following this budget reconciliation process, one of the things that's a little unique about this process is that using this particular process requires only a simple majority to get the budget passed. So as you, I'm sure, are aware, it really means that the focus on the folks who have the most influence over whether this moves forward happen to be Republicans at this point, because they don't need Democrats to join in order to get a simple majority. And so the budget started in the House. They passed a budget that we thought was pretty devastating, and I'll talk about some of that. It went to the Senate, and the Senate had the option of either adopting the budget as it came to them or creating their own version. So they recently just passed their own version of the budget, which made the cuts from the House even deeper and more steep and more devastating. Now the process is it goes back to the House. The House can adopt it as is, in which case it goes to the president for signature, or they can make their own revisions, and the process sort of starts again where they send it to the Senate. And it takes both houses to sort of agree on a version in order to move it forward. And so I think that the biggest opportunity right now, and the reason this is so timely, is we need to reach out to members of the House and say that this version of the budget is unacceptable. We're swimming upstream a little bit in that the president has made it a priority to try to get this wrapped up by July 7th, so right after the holiday. So there's a lot of pressure right now on members of the House and Senate to get it done. So that's why sort of immediate action, if people are interested in getting involved, sort of now is the moment to get involved. I think I'll share my screen and I can kind of hop around and share a little bit of data with you, and then we can certainly open it up to questions about anything that you would find helpful to sort of talk about. But hopefully you can see my screen now. Are we all seeing it? Okay, great. So I don't think that, I have to sort of, I always feel like, when we're talking to Jewish spaces, we should always anchor this in that this, feeding people and taking care of their basic needs is certainly something that's deeply embedded in our Jewish values. And so it should be no stranger to us. But I also wanted to, sometimes it's very hard to think about kind of national level data. The numbers are so big. And so I was just recently at the Kinder Institute for Urban Research. Many of you may be aware of the work of Stephen Kleinberg, who started a community survey probably 30 years ago, and it's been done every year since. The most recent survey that just was published of data that was collected in 2024 shows that 2 in 5 households in Harris County are food insecure, and which matches very closely to sort of what the United Way data is. They show in their data that there's over 1 million households in the Houston's 3-county region that are living either below the poverty threshold or what they call ALICE. And ALICE are these asset limited income constrained employed households, working poor is what we used to call those folks. So a full 44% of households in our region are considered at risk for poverty. And that number is going up dramatically. Between 2010 and 2022, the number of households at risk increased by 24%. And the number of households that fit this sort of broader definition of, being ALICE, which is not quite at the poverty threshold, but sort of barely getting by, has increased by 49%. And in Harris County alone, 1 in 4 children are living in poverty. And so, this just dives into how this sort of plays out a little bit more by individual population. But I think one of the things that we often hear in the Jewish community is that, oh, poverty is not a Jewish issue. Jews are well off, and it's a myth, obviously. And this data comes from a national survey done by Jewish Federations of North America that shows that in the Jewish community around the country, 1 in 5 households are financially vulnerable, and 7% of Jewish households are saying that they are unable to meet the bare necessities. And so not only is this a national problem, but it's certainly a problem within our own community. One of the things that I think, that we need to know is that food insecurity and poverty in many ways is concentrated by the numbers in Houston. 22% of all the cases across the entire state of Texas for people who are receiving SNAP or food assistance are in the Houston area. And you can see the breakdown that, many of them, because of the nature of the program, are young children. But I think that what people don't know, and what I think the media is misrepresenting, is that the elderly population is a huge part of who receives these benefits, low-income elderly folks. And so, and then the other thing that people often say is, oh, well, if food stamps or whatever are cut, philanthropy will pick up the extra. Well, nationwide, 95 cents of every dollar spent on feeding people who are hungry comes from government sources. So this is clearly a problem that is too big for philanthropy to solve on its own. We have a very, very generous community in Houston, but you can't go, in one fell swoop from paying for 5% of the problem to trying to pick up 75% or 80% of the problem. Just to give you a sense of sort of the size and scale, you have a breakdown by county, but in Harris County, our largest county, there are currently 657,000 individuals receiving food assistance through the SNAP program. And one of the things that the budget is trying to do right now is shift a substantial portion of the cost of running the program to the states. And we already know, and the governor just proved this recently, we already know that Texas is not a state that will pick up the extra cost. So one of the programs that's at risk with the cuts to SNAP are meals in the school for low-income children. And the governor was presented with an opportunity to fund this program for the summer for kids at risk, and he vetoed it. So he's very loudly declaring, if the costs are being pushed to the states, we're not having any part of it, we're not going to participate. So the other thing that we hear is that there's lots of lazy people on SNAP and these people don't want to work. Well, the truth of the matter is on SNAP, about 60% of the people are already working. And of those who are not, there are many reasons why they're not. They might be disabled, or they might be elderly, or they might be a primary caretaker for someone who's sick. So this idea that there are freeloaders that are sort of stealing money from the government just isn't borne out by the facts. When you also, one of the parts of the budget that is really under, is getting sort of huge cuts in the current proposed budget is Medicaid. And one of the things that I think is really important for people to understand is that 68% of adult Medicaid recipients are working. So these are people who are working but are not earning enough to get by or to have insurance. And the other thing that people need to understand, and I've heard a lot of the sort of talking points that are trying to support this budget, is that seniors won't be hurt if we cut Medicaid because they get Medicare. Well, they may get Medicare if they have a work history for their medical insurance, but there's a very large number of low-income seniors who rely on Medicaid to supplement their income, and a full 2/3 of the residents in nursing homes rely on Medicaid to pay for their nursing home care. So if Medicaid receives substantial cuts, there will be no way for these individuals to pay for nursing home care, and there aren't a lot of great options for them outside of there. So, in Texas, there are close to almost 2.7 million children who are currently enrolled in Medicaid. So this cuts to Medicaid also disproportionately impact children. The current estimates of, this just gives you a little bit more of a breakdown here in Harris County, who are the recipients of Medicaid, and you can see that a very large number of people who are on Medicaid have some sort of disability, and Medicaid is their only option for health insurance, because if they're not able to work, in the US right now, most of insurance comes through your employment. So if you're permanently disabled and unable to work, Medicaid is your source of health insurance. The current estimates are that if the budget goes through in any form that's similar to what is being proposed, about 17 million people across the country will lose their health insurance. So this is not kind of a small sort of impact. The other thing that I think is important to know is that this also disproportionately impacts smaller communities and rural communities. So in rural communities, across the state, there are critical access hospitals that are largely funded through Medicaid. And if Medicaid gets cut substantially, many of the communities, smaller communities across Texas, will lose their only hospital nearby. The other thing that we're seeing is that in smaller communities, grocery stores are largely dependent on people for their revenue, the revenue that comes in through food stamps through the people who shop in their stores. And across rural Texas, if these cuts come to snap, many of those grocery stores will close and people will have to end up driving 50 to 100 miles to the nearest grocery store. The other thing that I just will say about SNAP in particular, about food insecurity, is that many of the programs across the federal government that support food are all being cut at the same time. And so at the same time, we're anticipating a big reduction to SNAP in this current budget. The Houston Food Bank recently announced that they've already, through the efforts of DOGE and other kinds of cutbacks, saw a reduction of $11 million in their funding. So not only will direct assistance to food insecure households go away, but our Houston Food Bank will at the same time will have less food to distribute. So these folks are being kind of hit in multiple ways. If you're a low-income family who have kids in school, you've relied on your children getting part of their nutrition at school, like through free and reduced lunch and sometimes breakfast. And when those kids are not getting fed at school, whatever food resources they have don't stretch as far. And so we're seeing kind of multiple attacks to all of the different lifelines. Brighter Bites, which many of you know, a friend of ours, Lisa Helpman, created this amazing program to get healthy foods into schools. They've announced that they've experienced a 40% reduction in funding. So, many of these food sources are sort of being impacted at the same time. And so that kind of, brings us to this sense of urgency. We talked about sort of what the kind of next steps are as far as, kind of the process. I put up here just sort of 4 examples of organizations that have sort of ready-made letters. If people just want to fill out their name and address, it'll automatically address these letters to those folks who represent you, and it makes it very, very easy. If you don't know necessarily all the people who represent you, there's a link here that you can just go and put in your address, and it'll give you all the folks who represent you at various levels of government, so you can reach out to them if you want individually. One of the things that I've been experiencing quite a lot when I've been talking to groups is, when presented with a threat, there are sort of three natural reactions. You hear about fight and flight, but the other reaction when people are facing an overwhelming danger is freeze. And I feel like many people across the country are in freeze mode. We are being hit in so many different fronts, in so many things that we're just feeling frozen and unable to act. And I think, I understand it, and I feel that way sometimes myself, but I sort of feel like now's the time more than ever when everyone is called upon to do something. No one person has to do everything. That's part of our teaching in Pirkei Avot, right? Lo alacha hamlacha ligmor. It's not ours to finish the work, but the second part of that phrase is, nor are we free to sit on the sidelines and do nothing, right? So our tradition teaches us everyone should do, something. One of my good friends and mentors always says, the first step in figuring out what to do is to say what work needs to be done, and then to ask yourself what's uniquely mine to do. And so I think we need to ask ourselves and our communities to say, what is uniquely ours to do? Can I make a phone call? Can I write a letter? Can I reach out to someone? And then the next piece of the work is when this budget does pass, and I think even in the best case scenario, it will not be a great one. Our community will then need to figure out how to live with the consequences, and how do we continue to care for those most vulnerable in our community with whatever consequences are likely to come out of whatever revised budget ends up passing in the next few weeks. And so that was part of the reason I reached out to our clergy colleagues, is that, at JFS, we've been very, very proud to be a resource to people in need in the community. But if something like this goes through, our resources will be overwhelmed by the demand of people showing up. And we're going to all need to think together as a community about how do we do the best we can with whatever resources we have to take care of as many people as possible. And so with that, I'm going to stop talking and let you answer or ask questions or, whatever I can say that would be helpful.
Carl, you had shared with us last week a little bit of your calculations of the direct impact this would have on JFS and on the people JFS serves. Can you say a bit more about that?
Sure. So currently at JFS, we take care of about 330 families who are receiving SNAP, just as one, example. If SNAP were to substantially go away, for us to replace the loss of food benefits would probably cost us an additional $800,000 to $1.5 million, depending on how it plays out. To give you a sense, we currently distribute somewhere around $1.5 million in financial assistance to the community every year. So this would require, just on food alone, and just for our current clients, not, any new people who would show up, we'd almost have to find an extra, to double our budget, which is just not likely to happen in the near term. The other thing that would likely happen to JFS is, many of you might be aware of our program called Celebration Company, which employs people with disabilities. It's been very, very successful. Many of the people in that program, their participation is funded through something called the ISS program, or a Medicaid waiver. It's a funding stream that gets funded through Medicaid to help people with disabilities get the resources they need in whatever program makes the most sense. Probably half of our people in Celebration Company are connected to a Medicaid waiver program. And so if that funding went away, those folks would either need to find the resources to pay privately, which, since they're in the program, that's not likely that they have the resources, otherwise they wouldn't be qualified, or we would have to find the money to supplement the loss of revenue from, which could be in the neighborhood of a couple $100,000 a year. And so, I think we're looking at, and then if people start losing health insurance, medical bills and other kind of things, the demand, it just sort of spirals. Fortunately for JFS, we're not the direct recipient of a lot of big federal grants. So I don't think the impact, we will feel some impact in revenue, but it's mostly, I think, our staff is really worried, how will they continue to be a resource if some of the programs that we've depended on the most are no longer available. And so I think, but I can tell you, I'm part of a national network. There's an organization called the Network of Jewish Human Service Agencies that, we have about 170 member organizations like JFS around North America. And many of my colleagues have already had to shut down programs, have significant layoffs. We're one of the few, that I interact with on a daily basis that hasn't had to take those steps at this point. And we hope never to. I mean, that's not our goal, but it's a pretty startling reality when we get on, our regular conference calls and people are sharing what's going on in their communities. And, people are facing some pretty hard realities as these funds dry up. The other thing that has been very unusual about this administration, and I've been in healthcare for close to 40 years, so I've got some experience with, usually when a program changes, there's an announcement that it'll be sunset in 6 months or a year or 2 years, and that gives the agencies that receive that funding in the communities time to plan for other things. That's not been the case with this current administration. When they end things, they end it immediately. And it really is not giving a runway for the communities and organizations to respond and to put other sort of measures in place. So we won't know on this budget the exact timing of all the cuts until we see final language. But I think many of them we would expect to start rippling through these programs pretty quickly. So I'll say the same thing I said to the clergy the other day. I don't like to be the bearer of bad news. We usually like to come with exciting, here's what we're doing new, but I really do believe that this is, although this will be self-inflicted, the size of the impact of this is going to be relatively catastrophic in most communities. And I think we've all been focused on Israel and anti-Semitism for very, very good reasons. Those are also scary topics. But I think it is sort of perhaps caused many people across the country to be less aware or less tuned into some of these potential impacts. And so I felt it was our duty to kind of raise the alarm a little bit and try to get people activated to reach out to those people you have influence with.
So I'm hearing you saying that in the immediate term, is to call your member of the House of Representatives as soon as possible to say these provisions will do grave damage to the Houston community and to communities like ours all over the country. And in the longer term, to be engaged with the congregation and with you and JFS about what we're going to do for the people who are going to be hurting as a result of whatever form of this legislation may pass.
100%. And I'll share something. I shared this with Rabbi Fixler the other day. Lizzie Fletcher often says to me, she's very much aligned with these values that we're talking about, has been a big supporter. And she says to me often, don't stop calling my office just because you can count on my vote. All of the offices keep track of how many people call on each side of the issue. And she says it really helps me in talking to colleagues in Congress if I can say, my office is being flooded with calls, 80% saying don't do that or whatever, so she first mentioned it to me after, October 7th. She said, the opposition is out calling you 2-1. Don't forget to call my office just because I'm supportive. And so obviously when we call there, our tone is very different because, I always want to say thank you and, we need your continued support. But, these offices, whether it's here in their district office or in DC, they log every single communication that comes in and they keep track of it. And so, whether you call or email or write, or if you're in the neighborhood and you stop by the office, they do keep track of that. And that data helps them not only form their own opinions about what to do, but also helps them talk to colleagues and say, this is a huge issue in my district and here's the data to back that up.